Family, we are talking about the top 3 viral healthcare trends that are going on right here, right now. As you join, drop in the chat, where are you joining from? If you're new here, let's talk about it. There's so much going on the timelines. You know, anytime there is something health, wellness being discussed, I am like leaned in to learn. What are the people learning about? What are the people interested in? How can we help, when it comes to healthcare? But also I want to know, what type of things are we going to start seeing in the office? What type of side effects are we going to have to start monitoring in the office because of what's going on? And so I'm always leaning in when it comes to healthcare trends. And there are 3 really interesting ones that are happening now. And I want to talk about it with you all. My thing is, it's about safety. If I can talk about what's going well, what are we innovating? I'm all about healthcare innovation, but let's talk about the top 3 trends that are going on in healthcare right now that are on your timelines, and let's talk about the pros, the cons, and I'm here to answer any questions you have. For those who are new here, I'm Dr. Jade. I'm a board-certified family medicine physician. I'm a wellness and weight loss specialist. I'm the founder and medical director at NSPIRE Primary Care in Las Vegas, and my childhood dream come true is providing my hometown with quality healthcare, where your healthcare is easily accessible with a team that knows you well, and we can help you prevent and reverse chronic disease and to age well. So that's our mission, that's our goal, and that's what we've been doing really well for the last 4 years, and it's our pleasure to do so. But let's talk about it. Well, before we go into it, if you're looking for a healthcare home, if you're in the Las Vegas Valley and you've been looking for a healthcare home, if you found accessing quality healthcare to be difficult, if you're trying to use your insurance card and no one's taking it, or it takes 3 to 6 months to get in, or you feel rushed or like a number, these are the reasons we started NSPIRE Primary Care. Okay, this is why our doors are open, to give you quality healthcare where your team's an easy text or email away and where your healthcare home is at your fingertips. Okay. We would love to be your healthcare home. We are enrolling new members to our practice. We're a membership medical practice. Primary care is under our membership. All other healthcare, about 10% of care that falls outside of our practice. You can use insurance if you have it, or we have wholesale discounted rates for our members on labs, meds, and imaging. So we make healthcare really simple and affordable and straightforward and hassle-free. All right, and we're at inspireprimarycare.com, no I in front of Inspire, or you can just text our team if you have any questions. We're at 702-867-0017. Okay, here we go. Oh, and don't miss our March Madness special. Check our stories. We'll have a special going every month, but the March Madness special is really, really good. If one person joins an annual plan, it's 1 month free. If 2 people join an annual plan together, we're giving 2 months free per person. All right. Huge savings. And if a family of 3 or more join a monthly plan, then we will waive the enrollment fee for the whole family, and we will do the first month free for all children under 18. So don't miss our March Madness special. Many of you are taking advantage of that. Just text our team March Madness to take advantage of that. That's only until the 14th of March that the March Madness special is available. Don't miss it. It's a really good one. Okay, here we go. So trend number 1, viral trend number 1 when it comes to healthcare, as you all join, I see you all joining, drop in the chat where you joining from. Are you in Vegas or are you somewhere else? Let me know. All right. But healthcare trend that's viral, number 1, that I'm seeing a lot, lean in, okay? I'm not hating. I'm just letting you know what's out there so we can discuss the pros, the cons, what to look out for, things, questions to ask yourself. All right. The new trend when it comes to GLP-1s, we know that GLP-1s are still a hot topic. Medical weight management is there's a huge demand. And I am a big fan of medical weight management when it is managed with someone who specializes in medical weight management, right? A physician, a provider that specializes in medical weight management, knows how to accurately prescribe it and also knows how to handle side effects, right? Appropriately. So the trend number 1 is influencer-based GLP-1 affiliate marketing. All right. So what's happening is weight loss companies are saying, man, we want more customers and we want more customers fast. So how can we get to people? How can we get them to trust us and get people to enroll even faster? This is what the companies are thinking. And they're like, oh, well, people trust their friends. People trust the influencers on their timeline. So let's just give them a commission if they recruit people into our systems, into our online platforms, right? And so what's happening is when you scroll your timeline, you're seeing people share their story. They're saying, oh my gosh, I've lost so much weight on GLP-1s. I'm feeling so good. I have energy. DM me if you want to learn more, or click the link in my bio if you want to get on the same medications I'm on. And it's not necessarily anything wrong with that, but it does bridge it's right there on the fine line of what's ethical and what's safe, right? Because once you say, oh yeah, friend or person I'm following, I want to do what you're doing. I want to look how you're looking. I want to feel how you're feeling. Let me just connect with this platform. The platform gives that person money for that lead. And then you are then funneled into an unknown system. Safety is my question when it comes to this. So here's some questions to ask yourself. Doesn't necessarily mean it's bad. I don't knock a good hustle. And I also have no problem with people trying to get multiple forms of revenue. But I do have a problem with unsafe, unethical, especially when we're talking about medication that people are injecting into their bodies. And then physicians that are actually licensed, that are boots to the pavement, caring for people in the office, are left to actually deal with people's side effects. And some of them are reversible and some of them are not. So this is where my red flag goes up. Like, let's actually talk about this, okay? So questions to ask yourself when you see different affiliate marketing when it comes to GLP-1s and influencers on your timeline or friends on your timeline. The question is there direct physician oversight? So when you get pushed into these systems, the question is, am I going to see a physician, a licensed physician, or am I going to see a licensed provider, a nurse practitioner or a PA that specializes in medical weight management, a physician, an MD or a DO that specializes in medical weight management? That's one question. Am I going to see a physician or a provider that specializes in medical weight management? You also should be asking yourself, am I going to actually see them at a visit, right? Because sometimes they'll say, oh, well, it's physician oversight, or it's doctor recommended, right? These are different terms we can use where it's actually not the case, right? There's just a medical license attached to the company so that the company can then prescribe the medication. That is what's happening. So we just have to kind of unveil what's happening behind the scenes so that you are not vulnerable to unsafe medication that can lead to long-term issues. Other things you want to look at and ask about is, are they doing lab work before? Is there a physical exam happening? Are their vitals being taken? Are they getting a full comprehensive medical history and not just checking boxes on a form, but is a licensed provider or physician asking you your medical history? Because sometimes we'll put something on a form. For example, we had a member join our practice recently this week, and they put on their forms, we send forms for them to fill out before they come to our practice, and they put on their forms that they were healthy, don't take any medications. Perfectly fine. Okay, great. That's what the form says. But then we had conversation at our first visit, right? And getting to know them, getting to know more. I dig more into, so have you had any hospitalizations? No hospitalizations in the last 12 months? And then their answer was like, oh yeah, I was hospitalized one time. Oh, tell me about that. Long story short, there was a pulmonary embolism history. Huge thing for us to know about, but to them, they don't take medication daily. They don't, feel sick. And so it didn't even occur to them to check that or put that on their form. That changed the whole trajectory of our conversation. I needed to dig more into what medication was given. How long were you on blood thinners? Did you see a specialist after that? Did primary care follow up? Was this lab work done after that? Imagine if I didn't even know that and I was just going off of an online form and then sending a medication right away and collecting money. That is what's happening on many of these platforms, and it's just not safe, you guys. So that's something that just take into account. How is the monitoring happening? So once you do get the medications, how is the licensed physician monitoring your progress, your side effects, not just how you feel and the number on the scale, but metabolically, how is your A1C, your cholesterol, how's your blood pressure, how are your kidneys and liver adjusting to this? This is what I mean when I say safety, okay? Most medications are processed through either your kidneys or your liver, and so that needs to be monitored when medication's being taken. So again, I love a good GLP-1 for the right patient population in combination with a wellness plan under the direct supervision of a physician or provider that specializes in medical weight management, knows how to monitor and titrate medication appropriately, and knows how to monitor liver and kidney function. So, and it's also important to have both a weight loss and a weight maintenance phase. What does it look like once we actually reach the health goal? How are we tightening the skin? How are we looking at protein intake? There's just so much more than just taking a shot, you guys. So buyer beware. And the main thing is for us to just be aware of what's happening, because it's like, oh, wow, we're making it even easier to get a shot. We're making it even cheaper, right? Because once people are very interested in something, it drives the price down. So people are saying, oh, I can get this for $100. I can get this for $200. And the question is, the medication costs what it costs. It's not an inexpensive medication. It is a pricey medication. And so the question is, if it is 3 times less than the actual price, then we have to ask ourselves about quality control. And we'll go into this in the next trend that we're going to talk about, because you need to know about the lab quality. You need to know about the facilities that these medications are coming from. So very important. This is why Inspire is your healthcare home. If you're in the Las Vegas Valley, we do all of this work for you. I know exactly which pharmacy partners to work with. They're the only pharmacy partners we work with. And I've interviewed and toured facilities throughout not only Las Vegas, but our neighboring cities neighboring states to find out which labs meet the protocols that have the safety measures in place for my members. So is your doctor that you're signing up with doing that? That's so important, right? Which is why we've had such wild success with our medical weight management in addition to our primary care programs here at Inspire, okay? All right, that's healthcare trend number 1. Healthcare trend number 2, that's going viral, that we want to just be aware of, and let's talk about the pros and cons, okay? And I see you all join in. Drop in the chat, where are you joining from, okay? Are you local in Las Vegas, or are you joining from somewhere else? If you have any healthcare questions, drop them, all right? We're going over the top 3 viral healthcare trends. All right, number 2. Healthcare trend number 2 is what you're seeing. They're calling it the gray market for peptides. Apparently there's a difference between a black market and a gray market, but they're saying, so longevity healthcare is a big hot topic right now. I would say the wave of GLP-1s, most of us know about that wave. And so the newer wave that's really gaining a lot of momentum is longevity care and peptide management around longevity care. All right. It's a very exciting field because there are some very early research that's been done and some promising results in some of that research. And, we get a little bit of research and people just go with it and find a way to make money. And the thing about it is, it's not about money. It's just about regulation. There's a reason that clinical trials have a certain amount of time that clinical trials need to be done. There's a reason why we need a certain amount of people in a clinical trial to know the actual safety measures and the longevity of the safety measures. So we've just kind of skipped ahead. And the thing about that, when we start prioritizing profit over safety, is we, the doctors that are, again, in clinics, get to see all of the side effects from that. So here we go. Gray market peptides. People are kind of going online or have these secret websites and getting these websites from out of the country and getting these boxes of peptides shipped to their house. People are sharing their stories. Again, there are some affiliate marketing aspects to it where people are getting commissions for sharing their story. So a lot of things, again, even in the peptide space, that are questionable on safety and on integrity, kind of all mixed in one. All right. And looking at ethical principles here, okay? So here's some questions to ask yourself. When you're considering this, all right? Where was it manufactured? That's a question you need to know, all right? If you're not going through a physician, if you're not going through a medical practice where they have already done this legwork from a medical lens for you, if you're trying to go out on your own and do this on your own because you're looking for the cheapest route, or to skate around safety protocols while things are going through clinical trials. So here are the questions to ask yourself, okay? Where was the medication manufactured? The other question was the medication made in a sterile lab? You need to know these things, right? These are the things I have to know before I send a medication for a patient. But if people are going into platforms or going through websites where they're not seeing a doctor, These are the things you want to know. All right. You want to know, is the pharmacy that the medication is coming from a 503A pharmacy? There are certain certification levels to a compounding pharmacy that, again, puts certain safety protocols into play, or that pharmacy will be shut down. So is it coming from a 503A pharmacy? You know, like, are you guys you got to do this research if you're going to go outside of a physician. Not recommended, but I'm trying to at least prepare you if you are going a less safe route. Okay. Is it accurate dosing? Because sometimes you're getting these boxes of medications at home, and then, some of them you have to mix yourself. Some of them are coming in lyo or powder form, and you have to mix it yourself. Just all kinds of things, you guys. Again, not recommended, but if you are going this route, these are the questions to ask yourself. Dosing accuracy, titration accuracy. And again, the main recommendation is to still go through, again, I'm all about healthcare innovation. I'm all about, I do like AI, all the good things, but when it comes to safety, we need to know when you're utilizing medication, how are your kidneys responding? How is your liver responding? We need to know your whole metabolic picture. And some things, there is a reason we've gone to medical school. It's not because you can't study a lot of things on your own or use technology for a lot of things on your own, but there are so many nuances that, you just have to have a medical background to understand how to pivot and adjust throughout the journey. So again, that's medical trend number 2. As you guys are joining, drop in the chat where are you joining from. Any healthcare questions, let me know. But we're going over the viral healthcare trends that are on the timelines right now and kind of the pros and cons of them for us to consider for safety. Okay. So healthcare trend number 3, that's kind of all on the timelines right now, and in a lot of articles. This one's more in a lot of articles because some people are really against AI and some people are really into AI. And regardless of where you stand with that, AI is happening and it's growing in every field, like it or not. And one of the things that is starting to be developed is what they're calling like AI symptom platforms. So, every industry, they're like, can you be replaced by AI? And so one of the questions is, can doctors be replaced by AI? It's going to be an interesting journey, but these AI symptom platforms that are being put out, basically, people, again, are putting symptoms on a form or symptoms into a system, and then a robot is able to prescribe you medication. And we're seeing these type of symptom platforms. One thing that's interesting, I read an article in Pennsylvania where this really healthcare system developed one of these, and it was mostly because there was such a shortage of physicians and they were in a more rural area where the next physician or the next medical practice was just so far away, where this was a tool that they were utilizing to see if it could solve a problem for a community. But if you're in Las Vegas, you don't have to go to these type of platforms because Inspire can be your healthcare home. Certain things, I love AI for a lot of things, but when we start making healthcare transactional, automated, without a human touch, without human nuances. Again, I gave the example of a recent patient who just kind of checked that their medical history was totally healthy. And after we had discussions and certain questions were probed, I found out that, you've actually recently had a pulmonary embolism, and that takes us down a whole different road of discussions for your health plan. So there are certain nuances that, as nice as a robot sounds, relationship-based healthcare just is still the best healthcare that there is. All right. And I can say that confidently. You want a physician and a healthcare team that knows you well. You want a healthcare plan that's personalized, tailored to you, your health history, your family medical history. You want a customized health plan that's looking for the specific prevention measures that you need as an individual, okay, not just a checkbox. And so that's why Inspire Primary Care exists, to be your healthcare home, your personal healthcare team at your fingertips, to help you prevent and reverse chronic disease and age well, all right, in each season of life. So if you've been looking for a healthcare home and you're in the Las Vegas Valley, Inspire would love to be your healthcare home. You can just DM us or text us the word info. Text is best. So text us the word info at 702-867-0017. Just if you want to learn more, or if you have specific questions about your healthcare and you want, or your health history, and you want to know if Inspire is a good fit, just text us at 702-867-0017. check our website out. We got a beautiful new website, and it really makes it clear about everything about our practice. Check out our frequently asked questions page. It'll answer a lot of your questions. We're at NSPIREPrimaryCare.com. No I in front of Inspire. Don't miss our March special. All right, our March Madness special. If you know that Inspire is meant to be your healthcare home, you've seen us all around town, and you keep saying that it's on your list and you're thinking about it, like, now is the time to lock in quality healthcare. And I know we all love a good deal, so we will do monthly deals, but the March Madness special is until the 14th of this month. If one person joins an annual membership, we will take 1 month off, 1 month free. If two people join together for an annual membership, we will do 2 months off per person. So 4 months total for the two. So that's a huge savings. And if a family of 3 or more join our monthly plan, we will waive the enrollment fee for each family member, and we will give each kid under 18, their first month free. So March Madness special is pretty dope. I'm really excited about it. A lot of you are already, it's only the first few days of March, and so many of you have already taken advantage of that March Madness special. So don't miss that. We have another week and a half for that special. And the healthcare trends to be looking out for, be looking out for the affiliate marketing when it comes to GLP-1s, okay? Be on the lookout for the gray market peptide space. Be on the lookout for these AI symptom platforms. Again, I've given you the questions to ask yourself. I've given you the things to be looking out for to keep yourselves healthy and safe, okay? We only get 1 pair of kidneys. We only get 1 liver. So these medications are processed through there. This isn't just, inject something. These are things we're injecting in our body potentially. These are medications we're taking potentially. And so we want to be safe. You should be seeing a physician or a provider that specializes in the management of these options, okay? And there are non-medication options as well when it comes to the health and wellness space, which we also help craft those options with our members. So I want you guys to stay connected. You guys are pretty quiet on me today. I see so many of you have joined, but you haven't told me where you're joining from, and I don't see any questions in the chat yet. It's okay. Sometimes I guess you just want to hear me talk with no interaction, but I do love when you guys interact. But I want you to stay connected. I have a lot of community connection events coming up. I'm going to be a speaker at quite a few local conferences in town. If you're in the Las Vegas area, I'll be sharing them on the stories. So hope to see you at some of those. I know I'll be sharing at a women's conference coming up in April that will be about hormones. So I know that's another hot topic. So I'm excited to share about that. And many others coming up as well. A lot of podcast interviews coming up. So lots of ways to connect and to get questions answered. I look forward to that. But other ways to stay connected, our practice hosts the Las Vegas Leader Lunch and Learn every other month, first Friday. So if you are a leader in the community, if you're a business owner, entrepreneur, thought leader in any field, we would love to see you at our Las Vegas Leaders Lunch and Learn. That's on April 3rd. So we've got another month to kind of RSVP for that. Spaces are limited. RSVPs are first come, first serve. The links are in the bio. The links are in the stories. RSVP for that and be there, because that's going to be a networking space for leaders. I'm also going to share a health and wellness topic that leaders need to know about, okay? And we're also going to give you lunch for free on Inspire, okay? So come on out to the Las Vegas Leaders Lunch and Learn. That's April 3rd, all right? And then if you are a lady, lean in. If you're a fella, pause. All right, ladies, lean in. I'm really excited. Our women's networking and meetup and connection group is called the Lady Leaders Pickleball Meetup, okay? We meet every second and fourth Tuesday, every other Tuesday. The next Tuesday coming up on the 10th of March is our next meetup. So if you're a lady leader, again, entrepreneur, business owner, change maker in the community, come play pickleball with us. A little friendly competition over wellness and connection and networking. It's a vibe. It's a really good time. So we hope to see you there. DM us the word pickleball and we'll give you the link to our private Instagram group chat where we put all the details of where we're meeting, what court we're meeting on, etc. So lots of good things. I'm going to scroll the chat one last time, see if you guys have any questions today. I hope you enjoyed this one about the healthcare trends that are just really popping on the timelines right now. But let's focus on really making healthcare relationship based, and we want it to be safe and enjoyable and affordable, all the things. And so that's why Inspire Primary Care exists, to have that combination at your fingertips. It's my pleasure to care for you all, through social media, and to answer your questions. And we would love to care for you if you're looking for a healthcare home in the Valley. I'll see you all next time. Bye.